As women gracefully navigate through the different chapters of their lives, growing older brings with it a variety of health challenges, some well-known, others rarely talked about openly. One such issue that quietly affects millions, but remains wrapped in silence, is urinary incontinence. This condition, although common, can be deeply frustrating, uncomfortable, and emotionally distressing. It can disrupt everyday routines, limit social interactions, and sometimes make even simple activities feel daunting. Yet, despite how widespread it is, many women suffer in silence, unsure if they should talk about it or how to find effective solutions. Understanding the root causes and identifying the everyday habits that unknowingly worsen this problem is absolutely vital. When left unaddressed, urinary incontinence can chip away at a woman's sense of independence, confidence, and overall well-being. But here's the truth. It doesn't have to be this way. You have the power to take control, to make informed decisions, and to take meaningful steps that can dramatically improve your bladder health and quality of life. This is not just about managing symptoms. It's about reclaiming your dignity and living life on your own terms. In the detailed guide we're about to explore, we'll highlight 8 key habits that many senior women may be practicing daily. Habits that, while seemingly harmless or even helpful, can actually contribute to bladder leakage, urgency, or accidents. By understanding and gently adjusting these behaviors, you can reduce the frequency of embarrassing leaks, prevent infections, and improve your overall urinary function. This knowledge is empowering because it shifts the focus from helplessness to proactive health care. Whether you're currently facing bladder control issues or want to prevent them before they start, this guide offers compassionate advice and practical tips to help you make small but impactful changes. It's about embracing a lifestyle that supports your body's natural needs, honoring your health, and nurturing your self-confidence every single day. So, take a deep breath and stay with us as we unfold these essential habits and strategies. Together, we'll embark on a journey to better urinary health, because your comfort, confidence, and happiness in your golden years truly matter. It's never too late to start caring for yourself in new ways that bring freedom, peace of mind, and renewed energy. Let's begin this empowering path toward a healthier, more vibrant you. Ignoring the urge to urinate. Many women, especially as they age gracefully, tend to overlook or delay responding to the natural signals their body sends to use the restroom. While it may seem harmless or just a small inconvenience to postpone bathroom trips, consistently ignoring the urge to urinate can lead to serious consequences over time. The bladder is a muscular organ designed to hold urine temporarily, and when you ignore the urge, it becomes overfilled or overstretched. This condition, known as bladder overdistension, places unnecessary strain on the detrusor muscle, the muscle responsible for contracting the bladder to expel urine. When this muscle is repeatedly stretched beyond its capacity, it can weaken and lose its efficiency. A weakened detrusor muscle struggles to contract properly, leading to incomplete emptying of the bladder. This residual urine left behind becomes a breeding ground for bacteria, significantly increasing the risk of urinary tract infections, UTIs, which can be particularly troublesome and painful for older women. Moreover, this weakening of bladder function can worsen symptoms of urinary incontinence, making control over bladder habits more difficult and impacting daily quality of life. Ignoring these signals not only affects physical health but can also lead to emotional distress, including feelings of embarrassment or frustration, which often go unspoken. It is essential to recognize that your body's signals are there for a reason, and responding to them promptly supports long-term bladder health and overall well-being. Actionable tip: make it a habit to visit the bathroom every 3 to 4 hours during waking hours. Listening carefully to your body's natural cues and not delaying bathroom trips will help maintain the strength and function of your bladder muscles, reduce the risk of infections, and improve your confidence and comfort throughout the day. Reducing fluid intake to prevent leaks. Many senior women believe that drinking less water will help reduce the frequency of urination and prevent embarrassing leaks or accidents. This common misconception often leads to limiting fluid intake in an attempt to control the bladder. However, the truth is quite the opposite. When the body is not properly hydrated, urine becomes highly concentrated. Concentrated urine is acidic and can irritate the delicate lining of the bladder, causing inflammation and increasing the sensation of urgency. This irritation makes the bladder more sensitive and prone to sudden, uncontrollable urges, which can worsen urinary incontinence rather than improve it. In addition to bladder irritation, dehydration can have other indirect but significant effects on urinary health. One of the most common problems linked to inadequate hydration is constipation. When fluid intake is low, bowel movements can become hard and difficult to pass. Constipation puts pressure on the bladder and pelvic floor muscles, further weakening bladder control and increasing the risk of leaks. This creates a vicious cycle where poor hydration leads to constipation, which in turn worsens bladder symptoms. It's essential to understand that maintaining proper hydration is a key part of supporting bladder health. Drinking enough fluids helps dilute the urine, making it less irritating to the bladder lining. Well-hydrated bodies also support regular bowel movements, reducing constipation-related pressure on the bladder. Furthermore, adequate fluid intake ensures that your body functions optimally, promoting overall health and vitality, especially important as you age. Actionable tip: rather than cutting back on water, aim to stay consistently hydrated by sipping fluids throughout the day. Strive to drink at least 6 to 8 glasses of water daily, adjusting this amount based on your activity level, climate, and personal health conditions. Choosing water, herbal teas, or other non-caffeinated beverages can help keep your bladder calm and healthy, while preventing dehydration-related complications. Excessive caffeine consumption. Caffeine is widely enjoyed for its stimulating effects, found in popular beverages like coffee, tea, energy drinks, and many sodas. However, for senior women, consuming large amounts of caffeine can have unintended consequences on urinary health. Caffeine acts as a natural diuretic, meaning it increases urine production and can lead to more frequent trips to the bathroom. More importantly, caffeine is also a bladder irritant. It can cause the bladder muscles to contract more often and unpredictably, leading to increased urgency and the potential for accidental leaks. For many women, especially those who are sensitive to caffeine, even moderate consumption can trigger uncomfortable symptoms such as sudden urges to urinate or increased frequency during the day and night. These symptoms not only disrupt daily activities, but can also impact sleep quality, causing frequent nighttime awakenings to use the bathroom. Cutting back on caffeine can make a significant difference in managing urinary incontinence and improving overall bladder comfort. Switching from regular coffee or caffeinated tea to decaffeinated versions or herbal alternatives can help soothe the bladder and reduce irritation. Additionally, being mindful of hidden caffeine sources in sodas, chocolate, and certain medications is important to avoid exacerbating bladder symptoms unintentionally. Actionable tip: to protect your bladder health, try limiting your caffeine intake to just 1 cup of coffee or tea per day. If possible, choose decaffeinated or caffeine-free herbal beverages like chamomile, peppermint, or rooibos tea, which are gentle on the bladder and can be enjoyed throughout the day without worry. This simple lifestyle adjustment can greatly reduce bladder irritability and help regain better control over urinary function. According to the Office on Women's Health, moderating caffeine consumption is a key step toward managing urinary symptoms and improving quality of life. Neglecting pelvic floor exercises. The pelvic floor muscles are crucial for maintaining bladder control and supporting the organs within the pelvis. These muscles form a hammock-like structure that holds the bladder, uterus, and rectum in place, providing the strength needed to prevent urine leakage. However, as women age, especially after menopause, these muscles can weaken due to hormonal changes, childbirth history, and general muscle loss. Weak pelvic floor muscles are a leading cause of urinary incontinence in senior women. Fortunately, These muscles can be strengthened with targeted exercises known as pelvic floor exercises or Kegels. By regularly performing Kegel exercises, women can regain muscle tone, improve bladder support, and reduce episodes of urgency or leaks. Incorporating pelvic floor exercises into your daily routine is a simple yet highly effective way to enhance bladder control. Consistency and proper technique are essential for seeing results. Many women find that performing 3 sets of 10 repetitions each day can lead to noticeable improvements within weeks. Over time, strengthening these muscles can provide greater confidence, reduce anxiety related to urinary accidents, and improve overall pelvic health. For best results, it's helpful to learn the correct technique, which involves tightening and lifting the pelvic floor muscles without engaging the abdominal, buttock, or thigh muscles. If you're unsure how to perform these exercises correctly, consulting a pelvic floor physical therapist can be very beneficial. Actionable tip: make pelvic floor exercises a daily habit. Set aside a few minutes, perhaps while watching TV or before bed, to perform 3 sets of 10 Kegel repetitions. Tracking your progress and staying consistent will pay off in better bladder control and enhanced quality of life. Relying solely on absorbent pads and protective undergarments are often viewed as a quick and easy fix for managing urinary leaks. While these products can offer immediate comfort and help maintain hygiene, relying on them as the sole strategy for dealing with incontinence can be limiting and even harmful in the long run. Pads merely mask the symptoms rather than addressing the root causes of bladder leakage. Overusing absorbent pads may lead to skin irritation, rashes, and discomfort due to prolonged exposure to moisture. This can cause further complications such as infections or pressure sores, especially in sensitive areas. More importantly, dependence on pads can sometimes create a false sense of security, discouraging women from seeking professional medical advice or exploring effective treatments that target the underlying issues. Taking proactive steps towards treating the cause of incontinence, whether through pelvic floor therapy, medications, lifestyle changes, or surgical options, can provide lasting relief and improve overall quality of life. Pads should be considered a backup option, useful for occasional accidents or outings when immediate bathroom access may be limited, rather than a permanent solution. Actionable tip: use absorbent pads as a temporary aid rather than your primary coping mechanism. If you find yourself relying on them frequently, it's time to consult with a healthcare professional. They can help develop a comprehensive treatment plan tailored to your specific needs, focusing on long-term bladder health and independence. Smoking is well known for its detrimental effects on lung and heart health, but many people do not realize how deeply it impacts bladder function as well. The chronic coughing that often accompanies smoking places continuous strain on the pelvic floor muscles, which play a crucial role in supporting the bladder and maintaining continence. This persistent pressure can weaken these muscles over time, leading to a condition known as stress urinary incontinence, where physical activities like coughing, sneezing, or lifting cause urine leaks. Moreover, nicotine and other chemicals in cigarettes act as bladder irritants. They can inflame the bladder lining, increasing the urgency and frequency of urination, and making it harder to hold urine for extended periods. This irritation worsens the symptoms of urinary incontinence, making bladder control even more challenging. For senior women who smoke, quitting smoking is one of the most beneficial lifestyle changes you can make for your bladder health and your overall well-being. Although quitting can be difficult, numerous resources are available to support this journey, including counseling, nicotine replacement therapies like patches and gums, and support groups that provide encouragement and accountability. Actionable tip: if you smoke, prioritize seeking help to quit. Contact your healthcare provider for guidance and explore smoking cessation programs that fit your needs. Reducing or eliminating smoking can significantly ease bladder symptoms and improve your pelvic muscle strength, empowering you to regain control and enhance your quality of life. Consuming fluids. Right before bed, it might seem natural to hydrate well before bedtime, especially to avoid nighttime thirst. but drinking large amounts of fluids in the evening can lead to a disruptive condition called nocturia, frequent urination during the night. Nocturia interrupts sleep cycles, leading to fatigue, reduced daytime alertness, and a diminished quality of life. In addition to the sleep disturbance, excessive nighttime urination increases the risk of falls or accidents when getting up in the dark, especially for senior women who may have mobility or balance issues. Managing fluid intake timing is therefore a simple yet effective way to reduce the chances of nocturia and improve both bladder control and overall health. Actionable tip: try to limit your fluid intake starting 2 to 3 hours before going to bed. If you need to take medications at night that require water, use the smallest amount necessary to swallow the pill comfortably. Ensure you drink plenty of fluids earlier in the day to stay well hydrated without overloading your bladder at night. This balanced approach helps prevent nocturnal bladder irritation and allows for a restful night's sleep. Avoiding medical consultation. Due to embarrassment, urinary incontinence is a sensitive topic for many women, and feelings of embarrassment or shame often prevent them from openly discussing their symptoms with healthcare providers. This hesitation can delay diagnosis and treatment, leaving the condition to worsen unnecessarily. The truth is, urinary incontinence is a very common medical issue, affecting millions of women worldwide, and it is nothing to be ashamed of. Healthcare. Professionals are trained to handle these concerns with confidentiality and empathy. By speaking openly, you open the door to a variety of effective treatments, ranging from behavioral therapies and pelvic floor exercises to medications or surgical options tailored to your specific condition. Early intervention can significantly improve outcomes, reduce symptoms, and restore confidence. The longer the condition is left untreated, the harder it may become to manage. Remember, seeking help is a sign of strength and the first step toward reclaiming control over your life. Actionable tip: commit to discuss any urinary symptoms with your doctor during routine checkups. If you feel uncomfortable initiating the conversation, consider writing down your symptoms and concerns ahead of time to share during the appointment. Taking this step early can lead to better management strategies and a much improved quality of life. Urinary incontinence is a widespread issue that many senior women face, but it's important to remember it's not something you have to silently accept as a normal part of aging. By identifying harmful habits and taking proactive steps, you can significantly improve your bladder health and overall quality of life. From maintaining a healthy weight and managing constipation to limiting bladder irritants and practicing bladder training, every small step contributes to lasting change. And perhaps most importantly, don't let embarrassment stop you from seeking professional help. Early intervention can lead to more effective treatments and better outcomes. So take charge of your health, stay informed, and embrace lifestyle changes that empower you to live confidently, independently, and without limitations. Thank you for watching this video from Senior Buzz, where we prioritize your health, comfort, and well-being in every stage of life. If you found this information helpful, don't forget to like, share, and subscribe to Senior Buzz for more trusted tips and insights on aging gracefully and living your best life. Until next time, stay healthy and stay strong.